Continuous positive airway pressure, or Cpap, is the first line of treatment for obstructive sleep apnea. Numerous studies show this method of applying the constant mild air pressure to the airway during sleep reduces apneic and hypopneic episodes and helps to relieve the signs and the symptoms of the sleep loss, such as fatigue, drowsiness, and cognitive and mood changes. Studies suggest these benefits are associated with significant improvements in the quality of life, particularly for those with moderate to severe obstructive sleep apnea. The more hours per night the Cpap device is used, the greater the benefit. One barrier to consistent Cpap use is the comfort, and this can affect the adherence. It's estimated that only about 2/3 of people who are prescribed a Cpap are properly adherent, which has remained largely unchanged over the past 20 years. In addition to the cumbersome nature of the mask, Cpap treatment is associated with dry mouth, nasal discharge, congestion, bloody nose, headache, sore throat, hoarse voice, and a reduced sense of smell. People who tolerate the Cpap masks and straps but find the constant air pressure uncomfortable may prefer one of the other options for the positive airway pressure. The first is called bilevel positive airway pressure, or BiPAP. With BiPAP therapy, a lower level of air pressure is used during the expiration and a higher level during the inspiration. This might improve the comfort, especially for people who use higher pressure settings with the Cpap and have trouble exhaling against the pressure, and is considered an effective strategy for the treatment of obstructive sleep apnea. The second is called auto-adjusting positive airway pressure, or APAP. With APAP therapy, the device automatically adjusts its pressure output to the pressure it senses during the breathing cycle, and it reduces the pressure applied when no events are detected over a period of time. APAP may be more comfortable for people whose apneas occur mainly in certain sleep positions or in response to variable triggers such as alcohol consumption, allergies, and upper respiratory infections. Clinical guidelines recommend the use of Cpap or APAP over BiPAP when possible, as the lower pressure during the expiration might not prevent the occurrence of the airway collapse. BiPAP therapy is also more expensive than Cpap or APAP, and this can represent a barrier for many patients. The cardiovascular benefits of Cpap have been somewhat controversial. Meta-analyses of clinical trials have collectively found that Cpap therapy is associated with small but significant reductions in both systolic and diastolic blood pressure, particularly in those with moderate to severe obstructive sleep apnea. However, these effects on the frequency of cardiovascular events such as stroke or heart attack remain less clear. Some retrospective studies suggest Cpap treatment can reduce the risk for cardiovascular events, but other observational studies, most importantly randomized clinical trials, have not found a significant reduction in the frequency of cardiovascular events and cardiovascular disease in obstructive sleep apnea with Cpap use. However, cardiovascular benefits may be greater in patients with more severe obstructive sleep apnea, which are often excluded from clinical trials. Additionally, in a small study of 244 patients with coronary artery disease and obstructive sleep apnea, a significant reduction in cardiovascular events was found when adjusting for adherence, suggesting increased use of Cpap may confer better cardiovascular benefits. Clinical trials have demonstrated that Cpap improves insulin sensitivity in patients with severe obstructive sleep apnea, but the effects of Cpap on blood glucose control are less convincing. A 6-month clinical trial examining the use of Cpap in individuals with obstructive sleep apnea and type 2 diabetes found that patients who were treated with Cpap experienced greater reductions in glycated hemoglobin levels compared with control patients. However, many other trials and studies suggest Cpap use has no effect on glycemic control, and the American Academy of Sleep Medicine has concluded that there's insufficient evidence to support the use of Cpap for glycemic control in adults with obstructive sleep apnea. Oral appliances, the most common of which is the mandibular advancement device, are used during sleep to physically keep the upper airway open by either holding the lower jaw forward or moving the tongue forward. These devices are usually custom fit by a dentist and are more likely to help people who have mild to moderate sleep apnea and are female, younger and carrying less excess weight. They are particularly effective for patients who complain of snoring, regardless of apnea status. Although not considered a first line of treatment for obstructive sleep apnea, oral appliances are sometimes used in those who are unable to tolerate the Cpap. Surgery can be an important part of the treatment approach to sleep apnea, when the obstruction is due to an obvious anatomical problem, such as an enlarged tonsil or adenoid, or a deviated septum. The goal of surgical intervention is to open the airway and decrease the collapsibility. There's considerable variability in the success rate of sleep apnea surgery, with estimates of the benefit ranging from as low as 35% to as high as 98%. There's no major studies that successfully identify which patients will most likely benefit from the surgery, but it's generally considered an appropriate option for patients with a severe correctable anatomical abnormality. Given the heterogeneity of obstructive sleep apnea, effective pharmacological treatment has been challenging, despite significant clinical trial efforts. Central sleep apnea, however, might respond to medications that stimulate breathing or promote sedation. Modafinil has been approved for daytime sleepiness in patients with sleep apnea. Other medications that are sometimes prescribed but are not FDA approved for sleep apnea can include Diamox to stimulate breathing, as well as sedatives. For people with obstructive sleep apnea who continue to suffer from excess daytime sleepiness despite a Cpap therapy, modafinil can reduce the daytime sleepiness and it can improve the wakefulness. Common side effects of modafinil include anxiety, headaches, nausea and nervousness, and this can lead to a high rate of discontinuation. In 2019, the FDA approved Sunosi for the treatment of excessive daytime sleepiness in adults with obstructive sleep apnea, and this represents an effective option with a more tolerable safety profile over the modafinil. The hypoglossal nerve is one of 12 cranial nerves, and is involved in control of the tongue. When stimulated, the hypoglossal nerve causes the base of the tongue to protrude forward, and this results in the opening of the airway. The hypoglossal nerve is stimulated by a device which is surgically implanted under the skin on the chest. A pressure sensor in the device detects breathing patterns, and it delivers electrical stimulation to the hypoglossal nerve intermittently to trigger dilation of the airway during inspiration. In a meta-analysis of outcomes for 200 patients with obstructive sleep apnea, hypoglossal nerve stimulation reduced the symptoms by up to 57%, and it was associated with reduced daytime sleepiness. An analysis of 5-year outcomes for patients who had received the hypoglossal nerve stimulation found 63% of the patients experienced a greater than 50% reduction in their symptoms, with sustained improvements in daytime sleepiness and overall quality of life. The hypoglossal nerve stimulation may be helpful for individuals with obstructive sleep apnea who fail to respond to the Cpap, and greater improvements in the symptoms can be expected for those with more severe disease, older age and lower BMI. Acetazolamide is a carbonic anhydrase inhibitor and is thought to promote respiratory stimulation by improving the body's natural response to fluctuations in carbon dioxide levels. A meta-analysis of 24 studies of acetazolamide used in sleep apnea found that the drug reduced the symptoms by about 38% and was effective in both central and obstructive sleep apnea. In addition to improving sleep-disordered breathing, studies suggest acetazolamide reduces blood pressure in hypertensive adults with obstructive sleep apnea. Acetazolamide might be particularly useful for patients with sleep apnea resulting from sudden transition to high altitudes. Nasal expiratory positive airway pressure, or EPAP. This treatment creates positive pressure only in the expiratory phase of the breath cycle, rather than continuous. The pressure is generated by adhesive nasal patches that function as one-way valves that close during the exhalation, providing the airway resistance pressure. These nasal patches can be more tolerable to some people than the Cpap. A meta-analysis of 18 studies, which included a total of 920 patients with obstructive sleep apnea, found that the nasal EPAP reduced the symptoms on average by 53%, and it was associated with improved oxygen levels and reduced daytime sleepiness. In studies that compared the nasal EPAP with the Cpap, the EPAP was associated with smaller reductions in the symptoms, suggesting it might not be as effective as the Cpap. There's limited evidence available demonstrating who is likely to respond well to an EPAP, but it's generally not recommended for patients with severe obstructive sleep apnea, reduced airway size or lung volume, high risk for airway collapse, nasal obstruction, blood gas abnormalities, or for use after a stroke. In this therapy, negative pressure is provided through an oral suction device that draws the tongue and the soft palate forward, maintaining airway openness. In a pilot study, oral negative pressure therapy significantly reduced obstructive sleep apnea severity and improved wakefulness. Study results published in 2019 described significant reductions in symptoms and oxygen desaturation associated with oral negative pressure therapy, with 64% of the patients achieving a greater than 50% reduction in their symptoms and comorbidities. For more on sleep apnea, herbs, supplements, or natural treatments, check out my website.